Oops, I'm sorry. Yes. Right. So if you have read and understood, considering it history-taking session, kindly begin.
Hello, I am Dr. Muhammad, one of the exam surgical candidate. Today I have been asking to ask you some questions. Are you okay with that?
Yes, no problem, doctor.
So may I confirm your name and age, please?
I'm Mr. Harry, 64-year-old.
Okay. What's brought you here today?
Okay, doctor, I've been passing blood in my stool in the last 6 months.
Okay, is there any else?
Is there anything
else?
Okay, then I developed abdominal pain and then problem passing physics in the last 2 days also.
Okay, I'm so sorry to hear that.
Yeah, thank you,
so,
doctor.
Did it start suddenly or gradually?
Yes, the passing fresh blood started initially small, just traces, but in the last few days now, it has become so much.
When did you first notice that?
6 months ago.
Okay. Do you have any pain with that?
Yes, I have pain in my tummy.
Okay. How many times it's occur per day?
That I have pains per day or?
Sorry?
I didn't get you, doctor.
How many times it occur, the bleeding per day?
Okay, yeah, maybe 2 times or 3 times maximum, but usually about 2 times per day.
Okay. It's how much? It's about like streaks or teaspoon or more than that?
Up to 200 mils, so it's about handful, so it's about 200 mils per episode.
Okay. Did it ever become worse?
Did it ever become
worse?
Worse?
No, it has been the same. And yes, I told you now that initially it was just streak of blood, but it's in the last 2 weeks that it's now about 200 mils per episode.
Okay. Does anything make it increase or decrease?
No, nothing.
Okay. Do you have any change in your bowel habit?
Yes, I've been having occasionally I will have constipation, then I will have diarrhea again, constipation again. So I've been having that.
Do you have, did you notice any intentional weight loss?
Yes, I've lost weight. People are complaining that I'm losing weight.
So do you have any itching?
Itching? I don't have itching.
Yes. No. Okay. Do you have any swelling around your anus?
Around my
opening.
Okay. Do you have any mouth ulcer?
I don't have mouth ulcer.
Have any fever?
No, doctor.
Okay. No. Do you have any skin change or joint pain?
No, doctor.
Did you have been abroad recently?
No, I don't. I've never traveled in the last 2 years outside the country.
Do you have the urge to go to pass stool?
Yes, I have the urge to pass through.
Okay. Do you have any other conditions?
Yes, I'm hypertensive for about 10 years now, and I've been on
Okay.
medications by my GP.
So you go for your GP.
Yes,
Okay.
for the treatment.
Do you have any allergic to any drugs?
No, no,
Are you taking any long-term medications?
no. Apart from the one for my hypertension, nothing.
Okay. Do you mind if I ask you some personal questions?
No, go ahead, doctor.
Okay. So what's your occupation?
Yeah, I'm a shopkeeper.
Okay. Who is at home with?
My partner and my 2 children.
Okay. Do you have any difficulty with the stairs?
No, doctor.
Do you drink alcohol?
No.
Do you smoke?
Yes, I smoke.
How many times per day and how many packs?
Okay, maybe in the last 35 years, maybe about 10 sticks per day.
Okay. Do you have any cough or shortness of breath
No, doctor.
or chest pain?
No.
Do you have any urine symptoms or urinary symptoms?
No, my urine is fine. I pass urine fine.
Okay. Well, so what do you think is the problem?
Okay, I don't know, but I'm worried that I've been passing blood, which is abnormal for the past 6 months. So I'm really worried. I don't know what's the problem.
Dr. Mami, can you present your history now?
Okay, this is a 64 years old male presented with bleeding rectum and also has constipation for 2 days. This condition is lasting about 6 months, and he's not he's hypertensive. He's taking medications, and also he's presented with abdominal pain and weight loss.
Okay. So what are the differential diagnoses that you consider for your patient?
This patient has most likely CA colon, or it can be inflammatory bowel disease.
Okay.
And also can be I may have hemorrhoid or anal fissures, or have
how would you
colitis.
How would you confirm your diagnosis?
After the history, I will run those examinations.
Yes.
After that, I will do some investigations such as colonoscopy and sigmoidoscopy, and also I will do LFT with urea and electrolyte, and also I will do APG and ECG.
Okay.
For mesenteric ischemia, and also I will do stool cultures.
Stool culture or colonoscopy and biopsy.
Also, my abdominal ultrasound or CT.
Okay, so what management alternatives can you offer to this patient?
Management, I will, according to the investigation.
Yes, and after discussing in MDT team.
Yes. MDT.
Yes, then?
A patient might need surgery for such as colectomy.
Yes, good. All right, Dr. Khalade, can you please give feedback first? This is his first time Dr. Mohammed has done any history taking station, so yes.
Okay, ma. And thank you, Dr. Mohammed. You try to cover most of the areas, but I'm surprised that you still miss some things that were even given to you in the question part, like you didn't ask for appetite, you didn't ask for abdominal pain. So I think you just try as much as possible to also read the question at times. That may also give you some clips that you can use to ask some questions that you're able to ask. And then the time, I know you're talking so gently, so I think you may also need to move as fast as possible so that at least you can have asked most of the questions before your 6 minutes is gone. It seems to be too much relaxed, but time will not be that sufficient. And then I think you are trying to ask Enos. I think it should have been the back pass.
Yes.
I hope that was correct.
Yeah.
So because that's what I was
yes.
asking. When
Even
you're asking Enos, I was wondering
yes.
what. So sure you get. So the back pass, the urinary tract. Once you ask about the water works.
Waterworks, yes. And the back
so I think you should. Then the other thing that is also very important that I noticed is the ask history of family,
yes,
of cancer, or maybe colonic cancer or cancer-related death, since the cancer is a top differential diagnosis in your mind.
But sorry, in such case, it's presented post bleeding by rectum and abdominal pain. I think 6 minutes will not be enough to ask to analyze both symptoms.
You have to ask quickly. Like Dr. Kolade is saying, you have to if you know the question structured and you have to rule out, then you'll ask quickly. And maybe if you'll go back and listen to some recordings, some of the candidates were very smart. They used to ask 2-3 questions in one sentence, to rule out if there are any associated fever or cough or anything they want to rule out. So they'll ask you 2-3 sentences in 2-3 conditions in one sentence. So this will save time.
Okay.
Good. Yes. Otherwise, this is your first history taking. So I'm not going to give you a strict feedback. You still have time to learn and improve. So we'll practice, definitely. And we'll get there. And inshallah. And you have to promise to have the energy booster. Thank you.